We are going to go right into talking about California and the California Pad Innovation Project. Our speaker will be Kiran Sahota, President of Concepts Forward Consulting and the Program Manager for California's Multi-County Pad Innovation Project. Kiran.
And there we go. Whoops, nope. When I do that, it takes over my entire computer. So I'm going to have to change my mode here. Sorry about that. I had this all figured out too. I was all ready to go. I'm going to try that again. Okay, there we go. Technology at its best, especially in the afternoon. Good afternoon. I want to thank everyone for spending their day with us. And I especially want to thank the Sachs Institute, the MHS OAC, you heard from Toby this morning, our panelists, and most importantly for me, it's the 5 counties, Fresno, Mariposa, Monterey, Orange, and Shasta, that through their innovation funding are taking the first steps forward to move PADS to the forefront of mental health transformation in California. My name is Kiran Sahota, and as Chris just said, I am the president of Concepts Forward Consulting, and I am the project manager for the Multi-County PADS Innovation Project. And with that, I'm going to walk you through our slides. Now, some of this information you heard this morning, Toby talked about the innovation background, but I just wanted to reiterate how important it is, our Mental Health Services Act funding in California. We are a unique state where we do have 1% of our millionaires tax that does go towards mental health programming in California. And the Mental Health Services Oversight and Accountability Commission, or what we call the MHSOAC, they have a portfolio or a collection of projects and grant programs. The key element of their strategic plan is to transform the mental health care system in California. And these projects specifically advance the priorities of the Mental Health Services Act, including the reduction of the recidivism of hospitalization, incarceration, and homelessness. And as you've heard today as well, PADS really impact all 3 aspects of those of the recidivism in those areas. Traditional efforts of isolated innovation projects have been unable to move the needle on statewide transformative change. Yet the multi-county effort allows for collaboration, capacity building, and partnerships to meet the needs of a statewide systems change. And so, as you know, this PADS project, we truly are looking at a statewide systems change. You just heard quite a bit about the history of PADS. I had the Self-Determination Act as 90, however, I think I stand corrected at 91. But it did establish the patient's ability to develop advanced directives for their treatment at the end of life. And it also applied more broadly to the psychiatric types of treatment. However, since the 90s, 27 states, as you just heard, have enacted instructional PAD statutes. However, the expected widespread use of PADS just haven't come to fruition. And as you can see, many states are attempting to create PADS, and the movement forward and being able to give choice and voice to our mental health in the event of a crisis the momentum is there, but oftentimes the pieces all put together just aren't there. SAMHSA states some of the barriers, such as functional impairment of the individual, social isolation, and difficulty engaging persons with mental illness while in a crisis. Other barriers may be the lack of awareness or understanding of the PADS instrument or tool, and focus on physical health versus the whole person health. Big change that we're looking at in California is really merging both together. Skepticism that PADS will not be honored in a time of crisis, as we know that's happened, and perception that PADS are cumbersome and time-consuming, and that there may be legal constraints that just may not be realistic. So these are items that we want to address. So when we look at what our Mental Health Services Act Innovation Project objectives are, the counties have gotten together to look at what exactly we want to do in the state of California with this project. And really we look at wanting to standardize a PADS training. I looked at some of the questions in the chat, and I hope to answer 2 of these questions. What is stopping PADS from being supported in California? And then also, how are we going to really bring awareness to those that lack mental health awareness? And that's really what we look at the training and understanding to communities and stakeholders. We are not looking at this project as a one and done where you bring out another pad template and train people how to fill it out. That is not, it just hasn't worked. In all these years, it simply hasn't worked. We're really looking at training our communities and involving our peers, our NAMI, our stakeholders, our law enforcement, to say, what is it that you don't understand? What is it that you need to understand? And to have a standardized training that we can replicate in all our counties. We want to utilize peer voice when we look at a standardized PADS template. In the entire nation and multiple countries, you can see 25 to 30 different PADS templates. But do they really ever look at what the peers have wanted law enforcement to know, family members to know, hospitals to know? Do we need it to be 25 pages long? Maybe we need it to be 3 pages long with the option to have 25 pages of your information uploaded into a document. So really utilizing peer voice to standardize a statewide PAD template. And so with that, we want to create a standardized toolkit. And a lot of folks don't like the name standardized, but what we want is fidelity. We want to be able to train. We want to be able to have a PAD template and training that can be replicated. So no matter where you live, if you live in San Diego County and you've moved up to Fresno County or on to San Francisco County, that training and that PAD is going to be consistent no matter where you are in the state of California. We want to utilize PADs. We want to utilize peers to help create, to sit with that individual, to create their PAD. So knowing that lived experience and understanding can lead to open dialogue and trust. Hey, I was hospitalized, and have you thought about these different aspects if you were to be hospitalized? Do you want them to know your medications? Do you want them to know your allergies? Do you want them to know how it makes you feel? So really having someone with lived experience to sit with someone and creating a PAD. And we want to align PADS with the medical advance directive. Again, doctors have no problem seeking information on a medical advance directive, but being able to tie physical and mental health, which equals whole person health. And in California, that's what we want to look at, is really the whole person, not just the medical side of the house, but the mental health and medical. We want to create a fully functioning cloud-based platform. And what I mean by that is literally a place where we can hold, house PADs, training material, the template, anything that you would need with a PAD that literally would be utilized in the entire United States at some point. To be able to have that aspect of this project is pivotal, because when you look at the research, the one hangup through multiple states and countries is the lack of a place to put a PAD. And to have it in a standardized place where peers determine, hey, I want law enforcement to know this information. I want hospitals to know this information. I want my support person to have access to it, to be able to log on to a web-based app or a web-based platform, as we say, and to be able to pull the pertinent information that is directed by the voice and choice of our peer and the person filling out the PAD is pivotal, again, to this project, and being able to truly move PADs forward. That, again, no matter where you live in the state of California, you can have that PAD in every aspect of that state and throughout your life. If you wanted to change it as you change medications, if you wanted to change it as perhaps your support person has passed on or is no longer in the area that's going to be able to quickly assist with addressing your crisis. And also the ability to move something like this to multiple states and to eventually be nationwide. So I live in California, but I'm going to move to Nevada, and to be able to have that PAD be able to transfer with you very seamlessly, to be able to have law enforcement connect their systems so that dispatchers might be able to immediately say, hey, you're going out on this call, that individual has a PAD. And so before law enforcement ever was to be able to reach that call, they know that person has a PAD, and they'd be able to help address some of those de-escalation techniques that might be in that PAD. And ideally to help prevent the recidivism in inappropriate hospitalization and inappropriate incarceration. We do want to look at the legal aspect of it, and we want to look at creating a legal structure and not just using legislation to create a forced environment. Oftentimes, this is what we find happens with legislation. Legislation drives a project, which then falls flat. We would like the peers and our peer advocate groups, our family advocate groups, our law enforcement advocate groups to be able to say, this is why it's important, and this is why we need access to it. We need to be able to input it the way we would like it to be read. We would like it to be accessed the way we need it. But to be able to have the project lead legislation and to be able to make those changes, because when you have that acceptance at those county levels and those and within the state, it's going to be so much easier to be able to enforce it as we go forward. But really looking at how to enforce the use of pads, and a lot of that will be through the education. And then ultimately the outcomes is you can't improve a project without having outcomes. And so being able to look at what worked, what didn't work, what do we need to tweak, what is so fantastic, we can't wait to share it with the world. And so really looking at the ease of access. I mean, this is part of the fundamental flaw of pads currently, is the ease of use and the ease of access. And so really being able to create all those steps along the way to engage our communities, to understand pads and the importance, as you've heard all day, the importance of choice and voice, and to be able to use our peers and our stakeholders and our family members to help guide and lead this project. So that is the gist. I do have to say, this is an innovation project. And so when we're innovative, we may fail along the way at a few steps, but what we would like to see at the end is the success. And our ultimate goal of a statewide standardized pad template, toolkit, and a technology platform in order to move pads forward in California and hopefully nationwide. And with that, I thank you. And I will pass over back to Chris. Thanks.